Eggs donation. If a couple cannot get pregnant using their own eggs for the in vitro fertilization, they may require assistance from somebody who can donate eggs for them. Therefore, it's a very common procedure which we do in ART. Why we give couple donor eggs or embryos? Basically, if the couple had what is called a premature ovarian failure, in other words, the ovaries are no more producing any eggs, and that can happen maybe for 40 years, and we call it premature ovarian failure. They may have a diminished ovarian reserve, which then is the patient's got poor quality and low number of eggs. In that case, we advise that maybe we should use donor eggs. If the couple have genetic transmitted disease, which is passing on from parents to hair, which may put the children at risk, in that case, donor eggs may be used in that couple so that they can have a normal child. A previous history of IVF failure due to poor egg quality may also lead us to help that particular couple who want to be pregnant with donor eggs. Therefore, these four are the main common reason why ovarian or a donation of eggs is popular and is something most couples should look at. The use of donor eggs is becoming more common, especially among women who are struggling with fertility and those above 40. Studies have shown that since 2018, about all patients who are struggling to get pregnant, 42% of them do achieve pregnancy using donor eggs. Finding and choosing an egg donor. Most donations are anonymous. In other words, you don't know who gave you the eggs. They may give you some information, basics, but you never know who gave you those eggs. Some donors may be known to you. It's also acceptable. However, legal contract is very important between you and the known donor. Legal contract that explicitly spell out terms and conditions clearly and cover everything which may happen now and in the future. Finding a donor yourself sometime may be faster. It may be somebody related to you, and it may be faster rather than waiting for a clinic to provide you with a donor egg. You are permitted to interview the donor yourself. It is crucial for a donor to test or do certain screening tests to make sure that the donor is okay. The first one is genetic disorders, which should be screened. The second one is HIV. The third, hepatitis. And the last may be syphilis or syphilis and others. What to expect as an egg donor? An egg donor go through a process like IVF, but not through all the process at the steps. Step one, medical injection that can be GnRH analogs or agonists or N-gonadotrophins for 10 to 14 days. Step two is monitoring of those follicular growth using a gyne ultrasound until they are 18 to around 22 millimeters. And then step three is what we call egg collection or retrieval under anesthesia. Guidance of an ultrasound is also used when we're retrieving those eggs. And step four is when we fertilize the eggs with the recipient male partner in the laboratory using the male sperm. Who qualifies for egg donation? Anybody between age 21 and 34 do qualify for egg donation. Having a child as a donor is more important because at least it can show that you can produce a normal child. As well, having a donated before is so helpful in your side because that also will help you to understand how to inject yourself and how to take medication and what is anesthesia because you'll be repeating those steps. Screening for egg donor is very important from our side as Joburg Fertility. What we do a physical examination of the donor. We do gynecological examination of the donor. We do blood test and urine test. We look at the family history of the donor. We look at psychological evaluation as well of the donor. Is egg donation safe? That's probably what most of the people who are donating ask themselves. Is it safe really to do egg donation? In a study which was run in 2015, research where about 400,000 eggs were picked up. Some patients, as a single, produced more than 24 eggs. Those patients were followed up and they didn't have any problem when they wanted to have their own baby in the future. Therefore, egg donation doesn't prevent you or lower your risk of your chances of having children in the future. However, there's some short-term risk to be aware during donation cycle. Pregnancy can happen if you're going through medication and you're not protecting yourself with your partner. You can be pregnant. The weight gain is also something which you can expect when you start taking the injection, and also medication side effects like headache, mood swing, bloating, and tiredness as well. You can expect that. However, there is a complication which can happen during egg donation, which is called ovarian hyperstimulation syndrome, OHSS. Now, the symptoms of ovarian hyperstimulation syndrome are pelvic pain, nausea, abdominal pain, diarrhea, and abdominal distension, and even short of breath. Therefore, it's very important when you see or experience this sign after donating, you come back to the doctor quickly so that OHSS can be diagnosed and you can be put on proper treatment. The other risk as well during stimulation, you can have what is called ovarian torsion, which unfortunately needs a surgical intervention so that you don't lose the ovaries. Infection can as well occur during egg retrieval, and it's important that you are put on antibiotics so that you don't lose your ovary or you don't get infection in the pelvis. How painful is the egg retrieval? What you call egg retrieval. In other words, you have gone through the stimulation. Now you are ready for the eggs to be taken from you, and that is done under anesthesia, and then an ultrasound guided needle is put into your ovary so that we can aspirate those eggs. Now, symptoms which you may experience, especially after you have done egg retrieval, it may be bloating, a vaginal soreness, abdominal cramping, and a bit of spotting. Right? Therefore, if you see those signs just after egg retrieval, it's not really something you should be worried about. Is what we expect to happen. What are the tips to prepare for egg donation? Really, when you're donating the eggs, it's very important that you eat healthy and you stay hydrated, drinking enough water, and you regular or moderately exercise, like walking, swimming, and so forth, and abstain from something like tobacco and even alcohol. What are the legal implications of egg donation? This is very important as well, because if you donate, you really want to know what are the legal implications from your side as an egg donor. Children born through egg donation are not considered your legal children, despite their genetic relationship to you. Area covered by egg donation contract must include the following. Custody and parenting is the responsibility of the intended parents, not an egg donor. If the egg donor will have a future contract with any child resulting from the children, then it must be clear. In other words, if you donate the eggs and you'd like to follow the child which are born um, after you've donated the eggs, it's very important that you put it clear from the beginning so that you want to follow your children. But usually that condition we really don't provide. In other words, we don't encourage you to follow your children which we have donated as egg donor. it is very important that the donor as well remain anonymous. Exchange of medical information between the donor and the recipient as well is also something which we have to look at. And then in that case, usually we don't reveal the name, and it's very important information about the donor. Therefore, you can have the history, the screening test, and everything, but you won't have the particulars. Is a very important particular information about the donor. Therefore, as an egg donor, you will be told where to retrieve your eggs, where you'll come for egg retrieval. You will be given antibiotics, you will be given pain medication, and also you will be given a compensation in a form, sometime of a transport, or in the form of food, and as well, or some money which you can use during that process. Because the process of egg donation, usually it takes about 3 weeks. In other words, you'll be on injection for 10 to 14 days, and then from there, you then have to come and do the egg retrieval, which can take you the whole day. Therefore, you can be booked off from work if you are working. Expect to be off for about 3 days so that you can take your pain medication, can take your antibiotics as well, and then you can be in contact with the fertility center, which you provided with eggs. Thank you for everybody who's donating eggs and who's donating, especially Joburg Fertility. And we appreciate your assistance, and we really know how difficult to get to that decision. But we really, really saying thank you. Keep up the good work. God bless you.